all of you. I'm Sally with the Mesa Chamber, and we started our Aging and Healthcare Committee, I want to say around the first of the year, maybe a little bit before January. And then, of course, by March, we were virtual. And still working on basically getting all of our folks together to work on making Mesa a dementia-friendly city. And Karen has stepped up. Karen works with Oakwood. Karen used to be with Mesa PD, and that's how, gosh, Karen, I don't know how many years ago I met you, but 10 maybe? Okay. A long time ago, yeah. But Karen has been great to actually do some training for us. And so I'm going to turn it over to Karen. I have been through this, and so I'm going to mute, but if you guys need anything, just I'll listen, so holler. and I'll watch the waiting room. And you guys, this is great that you're all doing this, and spread the news that this is an opportunity and it doesn't cost anything, but then you can tout that you are a dementia friend. And I think based on the fact that we're all in Mesa, an aging community, we all need that, right? So at this point, I'll turn it over to Karen, and Karen, I'm going to share my screen.
Okay.
And you should be set.
We have animation. All right. Hello, everybody. I'm Karen, as Sally said. And first of all, before I switch over to the PowerPoint, by a show of hands, and some of you, I don't have your faces, but, or if you want to unmute and say, I am, how many of you are in the healthcare industry? Okay. How many of you know somebody with dementia?
I do.
I'm in the healthcare industry. It's Rose. I don't know why my picture doesn't show up.
Well, you're on here twice, so that works.
Well, my husband is on my other computer, so he wants to train too. And I don't know why it came up Rose twice. So one is Randy and one is Rose.
Okay. Well, and that it's pretty typical that most everybody dementia, whether it's a family member or neighbor or just somebody that they work with. So let me get started in the share screen. Oops. All right, where's my, from the beginning, okay. And I apologize, you have to have me on video at the same time. I don't know how to work Zoom as well, so I'm just going to go through my PowerPoint. So thank you all for joining us. As Sally said, I appreciate your time. We'll keep it to the 1 hour, so just respectful of everybody's evening. So this is a Dementia Friends session, obviously, and as Sally said, I volunteer with Oakwood Creative Care. It's an adult daycare. Most of our members have some form of dementia or cognitive impairments. So, and I'm also on the committee that Sally mentioned. So this is actually Dementia Friends Arizona. We're trying to get it throughout the whole state. So any of you that are interested in doing these sessions for either your company or friends or family, you can become a dementia champion through Banner Health. They'll put you through a virtual training, and then you can go ahead and do as many of these trainings as you have time for, actually. We do have a chat room. If anybody now here's the problem. I don't know how to get to the chat room and do the PowerPoint at the same time. So if somebody is monitoring the chat room, if somebody has a question or needs something, they can put it in the chat. And then if Sally or somebody could help me if there's something in there and let me know it's there, because I not mastered Zoom. I retired for a reason, and that was because technology was just getting way too complicated. So anyway. All right, so we'll start with the statistics. And as many of you probably know, Alzheimer's disease is just a growing disease. There was a statistic at one time that, 70 people get Alzheimer's every 60 seconds or are diagnosed with it. So right now, close to 6 million Americans have Alzheimer's disease. And those are the ones that have been diagnosed. There are many out there that never go to the doctor and get that diagnosis. So I think we're talking about many more folks when that's just Alzheimer's, and we'll talk about the different types. About 140,000 Arizonans have the disease. it affects everybody. It's a family disease, honestly. It affects the spouses, the children, the caregivers, extended family. It doesn't just affect the person with the disease. You can look at the increase in cases, 43% by 2025, and Arizona is actually one of the fastest growing states. According to the Alzheimer's Association, 10% of persons over the age of 60 have dementia, and about half of those over 85 have dementia. And somebody asked me one time, why do we have so many more cases of Alzheimer's and dementia than we did historically in the past? And it's really because people are living longer. If you're looking at this, where people are living to be 100 or older, half of those people, according to the numbers, are going to have some form of dementia. So that's one of the reasons. It's not, it's just the fact that people are living longer and we're seeing the greater numbers. So when we talk about dementia, those of you that maybe know people or have heard the word dementia, obviously, what words come to mind? You can either put this in the chat or you can, I don't know if Sally's going to let you unmute yourself and just kind of throw out a word. What is one word that comes to mind when you hear the word dementia?
Memory loss.
Memory loss.
Confusion.
Confusion, yes. Anybody else? Memory loss and confusion. Some of it is disorientation, and we're going to talk about, and that's really what the memory loss and confusion is what most people say when we say, what word do you think about with dementia? We've had disorientation and forgetfulness and things like that, and they're all related to the word dementia, obviously. So just to back up 1 second, this Dementia Friends is not, it's in the United States. It was started in Minnesota in the US, but it was actually developed by the Alzheimer's Society in the United Kingdom. And I used to do a lot of work on elder abuse, education, and prevention when I was with the police department. And they also, much of the elder abuse work was started in the United Kingdom. So they are kind of ahead of the US as far as their programs for older adults, but we do have it now in the United States. And basically we are volunteers of Dementia Friends. We are not experts on dementia. I'm not a doctor. I don't play one on TV. We're going to talk about basically what dementia is, how it affects people. And you as a new Dementia Friend by 5 o'clock today, we'll be able to talk to your family and your neighbors and just kind of give them the basics of what is dementia and what is life like having dementia, and how can we support not only the person with dementia, but also their care partners and their families. So that's kind of what we're going to go through today. It's not going to be clinical. It'll be pretty general about dementia and what we would like you to understand. So when we talk about dementia, the most common type is Alzheimer's disease, and that's probably about 60 to 80% of dementia-related illness is going to be Alzheimer's. But we also have the less common, the Lewy body, which is the second most common. Actually, Robin Williams, the actor, had Lewy body dementia. And they present differently. I have a friend, unfortunately, that has frontal temporal dementia. And so they present differently as far as behavior. You might have, like Robin Williams, hallucinations, sleep disorder, mood changes. He ended up, unfortunately, taking his life. Frontal temporal, the friend that I have, that what happens with frontal temporal is they kind of lose their social filter. So they say anything that comes to their mind, whether appropriate or not. And we used to deal with some of those folks, they might be the ones that will shoplift, or they might expose themselves, or they're going to do things that because they just don't have that filter that stops them from doing it. So just to understand, when we say dementia, it's kind of like the analogy to when someone says, I have cancer, I guess our first question is always, what type of cancer? Because there's so many types. There's over 100 types of dementia. So when someone says they have dementia, we can't make assumptions that it's just Alzheimer's disease, and we can't make assumptions about what their behavior is going to be. And, you know, they always say if you've met one person with dementia, or with Alzheimer's disease, you've met one person with Alzheimer's disease, because they are not going to be like the second person you meet or the third person, because their behaviors are going to be different because the person is different. And so we can't generalize their behavior. So whether we like it or not, when we get older, we go through changes. Some of you I can see are too young to have experienced this yet, but you know, I wear glasses now, I have gray hair, and I feel stiff when I get up in the morning. And that's exactly what it says in my notes here, that's what it means when you're getting older. So I can agree, that is exactly what happens. But that's normal aging. And we're going to go through what normal aging looks like versus what might be a sign of early signs and symptoms of Alzheimer's. So the first, when you mentioned dementia, memory loss. We all forget names, you know, who was that actress or actor in that movie, or gosh, I know I met you last week, but I can't remember your name. But oftentimes we remember them later. So we can bring up the memory. With Alzheimer's, an early sign is memory loss that disrupts daily life. They might have to rely on memory aids. And I know I do that, writing things down, putting things on my calendar, reminders. And some folks with dementia and in early stages are very good at fooling people and not letting people, because I'll just start, there is a stigma with having dementia. And that's what we're trying to get over during these classes, because we need people to understand it, that it is a disease. It's nothing that people can control. So, but when you know you have it, you try to hide it. And so you will see folks with dementia that might do a lot of notes, have a newspaper in front of them so they know the date, always have a calendar handy so they don't look like they don't know what day it is. But it's memory loss that disrupts your daily life. And often this leads to repetitive questions over and over and over again for the caregivers, because what has happened, as Jan Doherty says with Banner, they don't have a save button anymore. So whatever goes into their brain when they have dementia is not saved. I mean, you often hear that they can't remember what just happened 5 minutes ago, but they can remember what happened 30 or 40 years ago because they can't save any new information. So that's where it becomes, disruptive. The second sign is challenges in planning or solving problems. You know, we all make occasional errors when balancing a checkbook or things of that nature, but the person with dementia is not going to be able to keep track of their family bills. They're not going to be able to follow step A through step B. They might not eat, a recipe that they've been cooking for 40 years. Now they can't follow it because their brain can't make the connection to be able to solve problems and go from point A to point B. So, and it also takes them longer to do things, which is one thing we always stress, is you have to be patient with somebody with dementia because their brain is just not communicating the way it was. Difficulty completing familiar tasks at home, driving to a familiar location, sometimes getting lost, going to the store, someplace that they've been going almost every day. Again, managing a budget, remembering the rules of a card game, things that were always familiar to them, or at work, following procedures at work that they always followed and now they can't. Occasionally we might need help with computers, Zoom or electronics, but this is something where it's really something they've been doing for a long time, and now it's not familiar to them anymore. Confused about the day of the week, but recalling it later. I'll admit, between retirement and quarantine with the virus, I do lose track of the day of the week. I have to kind of keep track of my calendar, but that I can recall it later. So it's not a sign that I'm worried about dementia. But if they're losing track of dates and even seasons, not knowing summer, winter, fall, trouble understanding if something is happening right now as opposed to it happened before, forget where they are or how they got there. So again, we always worry about people with dementia wandering because they can easily get confused with where they are, what time of day it is it night, is it morning, where should they be? And again, that confusion that you talked about before. Vision changes, we all go through vision changes, cataracts, things of that nature. But what happens with dementia is they do have vision problems. That's very common with people with Alzheimer's disease. But now they have trouble reading and making sense of the words on the page, maybe judging distance. So when they're driving, they may be getting too close or they may be too far away because they don't have that depth perception. They can't determine colors or contrast. So they're having difficulty, of course, that would be with driving or recognizing certain objects because they can't tell the colors and the contrast with that. So those are some of the difficulties. Vision issues are a common sign. Having trouble finding the right word. And I know, I'll just speak with me because I don't know whether you have or not. Sometimes when you write a word down and all of a sudden you've been writing that word for years and now it just doesn't look right. It's like, what, is that the way? Yeah, I guess that's right. But so it's trouble finding the right word when you're speaking, something of that nature. But what happens with dementia is they have trouble joining or following a conversation and finding the words. I had a gentleman in one of my support groups that, bless his heart and may he rest in peace, he has passed away since then. I knew he wanted to join our conversation. I knew he had things to say about his life and things that he had done. But once he started talking, he couldn't put two words together in a sentence. And then what happens is, it goes down a little further, but he started to stop talking entirely because he knew he was so frustrated about not being able to put a sentence together. He was embarrassed and he was frustrated and he eventually just stopped talking altogether. So it's when they struggle with vocabulary or they can't find the right word, or call things by the wrong name. They may call, a pen, a fork, or a fork, a knife, or they can't make that connection anymore. And it's very frustrating for them. And it's something that the caregivers have to either help them with or, try, because we don't want them to be isolated. We don't want them to shut down. So, but it is very difficult for them. Misplacing things from time to time. Yes, that has happened. And then, what did I come in here for? But those of us that are just aging, we were able to retrace our steps. So we can, okay, I was here, I went there. Okay, here's where I put it. Now I remember. But those folks with dementia issues will misplace things and they lose the ability to retrace their steps. So they're putting things in unusual places. They can't go back and retrace. And we used to get calls at the police department. Somebody has stolen X from my house. We had one woman she claimed somebody had stole her purse. And when the officer went to the house to take the report, she had put her purse in the dishwasher. So she didn't remember that. And it was inappropriate. Well, I don't know, maybe you do keep your purse in the dishwasher. I guess no thief is going to look there, but it was something that she hadn't done intentionally. It was just that she had lost that ability to make a decision as far as that. And then she accused, I had another woman I worked with who was constantly accusing her granddaughter of stealing her frozen peas out of her freezer. So we have to be kind of cognizant of the fact that they may be saying these things, but we need to look through the house and find where they are. I had a caregiver tell me that her husband had lost at least 20 pairs of glasses, and she had yet to find them when I talked to her, because she has no idea where he's been putting them. So things of that nature. We all make a bad decision once in a while, but what happens with the person with dementia, because of their illness and the effect on the brain, they have very poor judgment. So they're not making good decisions. Financial difficulties are one of the first signs that somebody may be experiencing signs of dementia. They are making bad decisions. They can't do their budgeting. They can't handle their finances, dealing with money. They might be giving money away. This is where we see a lot of our older adults getting involved with telemarketers and fraud there, because they don't have the judgment to determine that somebody is trying to take advantage of them. We also get, sorry, my phone just went off with a scam call. So there we go. Look at that perfect timing. It's like, and so, you know, that I used to see this, I did a lot of classes on fraud prevention. And when you've got somebody with dementia and you've got a roofer coming to their door, you know, they just don't have the ability to make a good decision about strangers. Sometimes feeling weary of work, family, and social obligations. I think we always get there. A person with dementia may start withdrawing from work or social activities. And a lot of that is because of a lot of things we've talked about. They can't carry on conversations. They don't understand what's going on. They've lost their judgment. And so they can't keep up with their sports team. They can't keep up with the hobbies they've been doing for years. So they avoid it. They start avoiding being social, and that leads to more and more isolation. And we can't let that happen. And even during this coronavirus, we're seeing an uptick in depression in older adults because of the isolation, not only with people with dementia, but just people, you know, I was telling Sally earlier, I've even experienced, you know, people that live alone, people that can't get out, people that are afraid to socialize, or they're in our nursing homes and they can't have visitors. You know, that's been devastating to our older adults. So we can't let that happen with the isolation. And then developing very specific ways of doing things. And we get irritable when our routine is disrupted. That's just, it's not even aging. That happens with everybody, I think, no matter what age. But when you have dementia, you're also going to see changes in mood and personality. I've had caregivers tell me that one woman had told me that her husband never cursed a day in his life. And now he was, I'm going to say like a sailor, I guess, I don't know. You know, cursing, and he would get angry, and he's never been that type of gentleman before. We've seen some domestic violence type issues where the woman has accused her husband of cheating on her, and it's all part of her dementia. So they might get more outgoing, they might get more confused, more suspicious, more depressed, you know, fearful, anxious, any of those types of moods. It's going to change. They're not going to be the person that they were before in some cases. And that's very difficult for the caregivers and even for people that knew them and now see a lot of changes. Does anybody have any questions up to this point? Okay. I know it's hard to. So the 5 key messages of the Dementia Friends program is that, first of all, dementia is not a normal part of aging. You are not going to get dementia. It's not a given. So we want people to understand that. It's not a normal part. It is a disease. Just like other diseases, dementia is a disease. It's caused by a disease of the brain. And as we've talked about, it's not just about having memory problems. It's going to affect, behavior, personality. It's going to affect your other organs. People have asked, how do people die from dementia? Because as the brain changes and the brain starts shutting down, it starts affecting how your organs work. And a lot of folks with late stage dementia stop eating. They lose weight for various reasons. They don't remember to eat. They don't want to eat. They don't. So it's not just about memory. It really affects the whole body eventually as the disease progresses. It is possible to have a good quality of life with dementia. I know that may seem difficult, but I'll speak from Oakwood. We have some of our members that come in and they are doing art, they are doing music therapy, they are doing exercise, they're engaging with each other. They will, and I hope this doesn't sound offensive. I have a problem sometimes carrying on a conversation with some of them, but when you get 3 or 4 of our members sitting down having lunch together, it looks like any other cafe. They're sitting there, they're chatting with each other, they understand each other's. Some are having more difficulty than others. They don't criticize when they're dropping food on, they're so good with each other. And you don't look at them, they're having a good day. And really it's all about the moments, giving them moments that matter so they can still have a quality of life. And there's more to the person than the dementia. They may have dementia and they may change. We've had some folks that have never done art before and now they're doing artwork. And as we go through and talk about the brain and the bookcase scenario, you'll see that, yes, the dementia is there, the disease is there, but they are still a person that we need to respect. So when we talk about the brain, the healthy brain you can see on the left and the advanced Alzheimer's, and you can see the changes that it makes. So the damage interferes with how the brain cells communicate. So that affects thinking, behavior, and feeling. So you can very much see the difference in what happens to the brain. The brain has a lot of different areas. Each one is responsible for a variety of functions. And when it's like the advanced Alzheimer's, you've got some functions that just are not going to work anymore. So that's not very scientific, but that is what happens to the brain, the plaques and the tangles. You've probably heard of a lot of that terminology, and it just affects the way the brain can communicate. And this is kind of our example, maybe make it a little easier to try to understand. So a healthy brain, we have a full bookcase. We have a bookcase on the left, sorry. I've got paperwork in front of me that I'm throwing around here. So, and everybody's brain is affected differently. So you're going to have somebody with early stage that might plateau for several years and not progress. And then you'll have some that, like some of the frontal temporal dementia goes very quickly, or Lewy body might go quicker than Alzheimer's. So you do have everybody affected differently. So we have a 70-year-old woman in our example who is having some issues with dementia. So on the top shelf are facts and complex thinking. So that is the outer part of the brain, or the top of the brain, that is going to be damaged first by the dementia. So when we talk about facts and thinking, just like we went through normal aging versus dementia, you lose that ability to say facts, you lose the ability to do complex thinking, to do planning and things of that nature. So math, language, keeping your behavior in check, that's all part of the outside of the brain that's going to be affected first by the dementia. So when the dementia rocks the bookcase, the top shelves are going to be emptied first, as you'll see in the example on the right here. And that's when they lose the ability for the facts and the complex thinking. The bottom shelves, however, representing emotions, love, and happiness that come from further inside of the brain. So the inner part of the brain, the instinct area, the emotions, that part of the brain is going to be affected much further on in the process, if at all. And so when the bookshelf kind of rattles, the person with dementia is going to lose their top shelf abilities. However, and this is important when we talk about communication and caregiving for people with dementia, the bottom shelves of the bookcase stay for a much longer part of time. So your facts and your thinking are going to fall away, but your emotions and your feelings are going to stay much longer. So when you talk about maybe a daughter that visits our 70-year-old woman and they have an argument while she's visiting, the mother may not even remember what the argument was about, but she is going to remember how it made her feel, and the emotions and the love, comfort, support. That's what she's going to remember from that visit, not necessarily the facts. So when we when we talk about communicating, and we'll talk about that in a little bit, your emotions and your behavior towards a person with dementia are going to affect how they feel. So your body language, if you go in angry and you're having a bad day, and sometimes we just can't help it, or you're going in smiling, even though you're not saying anything, that is going to affect how they are going to feel at the end of your visit. So top shelves they're going to lose, but the bottom, they still very much have the emotions and the love and the happiness. And that's kind of what you see when you engage with them. They can still laugh, they can still tell jokes, they can still express compassion for other people and so forth, but they can't remember what they had for lunch 5 minutes ago. So that's what the difference is going to be. So we're not going to write this down. This is usually done. We're doing these virtual now, and that this PowerPoint was written for face-to-face. But when we talk about, and we've talked about critical thinking and following a plan. So if you have somebody with dementia living with you or that you're caring for, and you have to tell them how to brush their teeth. So what we would like you to do, and you can unmute and just kind of have a discussion. There's not too many of us here. Or think about or write down, take a few minutes to write down what would be your first step, your second step? How many steps would you need to have to tell somebody with dementia how to brush their teeth? And how specific would you have to be? So if you want to give that some thought, and then if anybody wants to start a discussion, that's fine. This is a little more difficult to do virtually, but go ahead.
I think you would definitely have to be very detailed in every step, because so many things we just probably take for granted. Just thinking, when you think, okay, you get a toothbrush, you get toothpaste. Well, you've got to find your toothbrush. Do you open the door to get your toothbrush, or in your drawer? Do you take the lid off the toothpaste before you can squeeze the toothpaste onto your toothbrush? You don't think about all those things typically, but for somebody that might not understand how, the process anymore, you have to get very detailed, I would think.
Yes. Yeah, when I did this, when I went through the training, I had over 30 steps of just brushing your teeth. Yeah. And the first was finding the bathroom. I don't judge if you brush your teeth in another room of the house, I'm not going to judge. That's where I started, was this is the room you need to go in. And yeah, so anybody else have any thoughts? Has anybody had to do this? And Linda's right, as far as we've had lists quite long where you start with getting them in the right room, showing them what their toothbrush is, which one is theirs, making sure they take out the right tube and that it is toothpaste that they're taking out of the drawer. already do assume. Do they wet the brush beforehand? How much do they wet it? How much toothpaste do they put on the toothbrush? Because you could have them stand there and squeeze out, 2 or 3 inches of toothpaste. Electric, turning on the toothbrush, where to put it, how to put it in the mouth. If it's manual, what do you do with it? What do you do with all the toothpaste in your mouth? Do you spit it out? Do you swallow it? Do you rinse? Yeah, then you're right. I mean, when you start thinking about everything that we go in and we do it and we're in and out of there, this might take 30 minutes to get them to just brush their teeth and then have to do it again the next time they have to brush their teeth. So you can see where this will get tedious for the caregivers, because every single time they are going to have to go through this same list. We've also done this with making a peanut butter and jelly sandwich, which always interests me because everybody's got their own little quirks on peanut butter and jelly sandwiches, but it's, getting the bread out, where's the peanut butter, opening the jar, getting the knife and making sure that they're okay with the knife, finding the jelly, where do you put the peanut butter? Is it on one side of the bread, 2 sides? So again, you have to think about every what if scenario, that you can't just say, well, make yourself a peanut butter and jelly sandwich for lunch. I'm going to the store, because, it's not going to happen that way. You have to be very specific. And so when you're talking to somebody with dementia, just like you said, it gets very, very detailed, every little thing. And when you're going to brush your teeth tonight, think about it. How many steps have you gone through just to do that one task? And that's only one thing during the day. So, I just give such kudos and support to our caregivers, because they are the ones that go through this 24/7. So when we talk about communicating with people with dementia, of course, it's always dignity and respect. We can't treat them any differently than anyone else that deserves our attention. I understand that their behavior is different and their memories are different, and they may not even know who you are. I had a woman, we had a member at our center, and he thought his wife was his mother. And so when I made the mistake of going in and saying, John, your wife is here, she's like, no, don't say that, because he doesn't recognize me as his wife. And so, but I still treated him, he's different, and he'll never be the person he was. He'll never be her spouse. She will never be his wife again. But he does deserve our dignity and respect in whatever way we can give it to him, whatever his world is. So again, be aware of your feelings. I mentioned that before, as far as you have to be positive and smile and uplifting, because that's what they're going to zero in on. If you're angry, they will feel anger, your anxiety. You have to be very aware of how you approach them. And patience, it's so important. You may ask them a question and it may take them 20 or 30 seconds to respond. So if I say, how was your day today? 1, 2, 3, 4, 5. I mean, just imagine, we don't have conversations like that in our daily life. We expect an immediate response. And when we trained our officers and fire and people that are first responders, we emphasize that you just have to, you're not going to go and get a report and get in and out of there. This is somebody that may not be able to respond and may forget your question after 5 or 10 seconds. And so you have to start over again. But patience and being supportive, helping them in whatever they're having difficulty with is just so important. Comfort and reassurance, like Larry, who I talked about, who was having trouble communicating and finding words. I always said, it's okay, Larry, we've got all day. what would you like to talk about? Does it have to do with, you're from Montana and you like, and so you try to reassure them that it's just okay. We don't want people to shut down and isolate themselves and feel that there's a stigma with what disease they have. We don't do it with other diseases. This is a disease, and I think people forget that. They see it more of a behavior than an actual disease. And so we have to reassure that this is no fault of your own. We'll work with it. What can we do for you? Well, how can we help? Avoid criticizing, avoid correcting, and avoid arguing. And I will tell you, you will never win an argument with somebody with dementia, because their world is their world. And if they say it's black and it's white, guess what? Go with the black, because you're not going to be able to correct them. It's just going to cause confrontation and agitation. So we do some training with improv groups, actually, for our staff and our caregivers, where we teach them it's all about improvising. My husband, my wife says she wants to go to Paris, we're going to go to Paris and eat in the cafe. And instead of saying, we live in Phoenix, you're not going to Paris, we're going to eat right here, and go with, okay, well, what's in Paris? What can we have? What can we do to make it feel like Paris? And just kind of enter their world. It's kind of a yes and, where you say, yes, you want to go to Paris, and here's what we're going to do, instead of a yes, but. Yes, you want to go to Paris, but guess what? We're in Phoenix and we can, because as soon as you say but, you're negating what they want to do. And if you want to, there are some videos on YouTube about improv and dementia, and it kind of shows you that yes and kind of conversation piece, which our caregivers actually thought it was one of the best tips that they had, because a lot of the folks don't drive anymore, but that doesn't mean they don't see the car in the driveway and think that they can still drive. So, honey, I'm going to the store. I'm going to drive to the store. And instead of saying, you can't drive, just sit down, you say, well, the car's not working. The mechanic's going to come over, in the meantime, why don't we have lunch, or let's have some ice cream? So you're trying to redirect them to something else, and hope, don't get offended with this, hope that they forget that they wanted to go driving. So it's a lot of redirecting. It's a lot of entering their world, because that is the world where they are. So it's just something that, you can't win an argument. Offer a word guess. If somebody's having difficulty in a conversation, are you trying to think of this, or write something down if they're having trouble, is it this, or draw a picture? Or it's not offensive to them to try to help them. It's worse if you just try to cut them off and don't let them talk at all, because at least when you're offering a word guess, you're engaging with them, you're giving them the respect they deserve, because they're trying to communicate, and it's no fault of their own that they can't anymore at that point. So do the best you can. And nonverbal communication, is it this? Is it show them a knife, show them a pen? If they're just having trouble finding that word, or don't quite know, that's not what you eat with, here's what you eat with, and just kind of keep it casual, instead of don't do, and I will admit, caregiving is not easy. My mother and I cared for my dad for 11 years. He had Lou Gehrig's disease, and that, he wasn't speaking, he was bedridden, he was on a ventilator, and gosh, it does get very hard. You have days where you're just like, just can't do this anymore. And that's what happens with our caregivers. There is a topic, and if any of you are interested, you can read the book called Ambiguous Loss. And basically what that is when somebody passes away, it's a loss. It's a definite loss. But ambiguous loss is when you have somebody with dementia that you are losing every day pieces of them, but they are still there. So physically they are still here, but emotionally and psychologically they're lost to you, because they're a different person. They're not, just like I said, he called his wife his mother. She had to recognize the loss of her marriage, even though her husband was still living with her. So that ambiguous loss, I think it's Dr. Boss, B-O-S-S, that wrote the book, but very much something that our caregivers have to contend with every day. So again, the 5 key messages, just as a reminder, it's not normal part of aging. It is a disease. It's more than memory problems. And we can give them, and I say it's possible to have, we can give them a good quality of life. And we're starting by being dementia friends and just kind of passing the word on to whoever we know. There's more to the person than the dementia. And that's something that, you know, very much, I mentioned my dad with Lou Gehrig's, we tried to look beyond his disease and remember that he was still my dad, my mother's husband, but oftentimes we're so focused on the illness that we kind of forget to address the person on a moment by moment basis. There's no homework, you're not obligated, but these are some of the things you can do as a dementia friend. Just stay in touch. If you know somebody that has dementia, these cards, I think Banner might have them, but just get in touch with someone, be patient, be understanding. And if you know groups that would like this presentation, certainly get with Sally, or you can email me, be happy to do them for any kind of group that's out in the Mesa community. You know, whether it's 5 people or 20 people virtual, you know, everybody can get involved. We're just trying to give everybody kind of a summary of what, and an introduction to what dementia is. So some of the resources, the Alzheimer's Association, obviously, and I actually just got an email from them today that there's some new drug that the FDA is looking at having a session on. I'm not sure the whole process, that has shown some promise for Alzheimer's disease. So that I just got that email this morning. So they're still working on, there's no cure. I do get the questions, does diet, exercise, and yes, all of that, you know, there's contributing factors and health lifestyle factors that may contribute to getting dementia. Sometimes it's family. I've known families where almost every woman in the family has had dementia, every aunt, grandmother on one side of the family. And of course that, you know, as somebody that we don't have it in our family, but if I did, I would certainly be concerned about my fate. And so some people get tested, some people will go through trials through the Alzheimer's Association or through Banner and see if they have the gene for it. The Area Agency on Aging, I've worked with them for years on elder abuse work, but they have all the work for adults age 60 and over, meals, transportation. They have respite care for caregivers, so they're a great resource, and a 24-hour helpline. Dementia Friendly America, that's the one that started in Minnesota, that's kind of the umbrella organization for dementia friends in Arizona, that's America. Banner Alzheimer's, they're the ones that do the champion training. So they're the ones that you would reach out to. And I've got Janice's email on the next slide. Banner Sun Health Research, and then Dementia Friends USA. So again, champion training, you can either get with me, Karen, at oakwoodcreativecare.org, or go through Sally, or Janice Greeno is the one that runs the Arizona program for Dementia Friends. They do a lot of Dementia Friends training through Banner, they're doing it virtually as well. They do have a Spanish one. So if any of you have Spanish speaking communities, go through Janice and get with her, because they are doing Spanish speaking Dementia Friends sessions. So she would be the one, just give you time to write that down to go forward with that. And if you want to be a champion. And this is all about Banner. They also have a lot of classes at Banner. If you want to learn more about Alzheimer's in general, and if you become a caregiver, they've got, you know, keeping them active, they got behavioral changes, they kind of break it down into different facets. So they're a great organization. So I will thank you and stop sharing here. Oops. Stop share. Yay. Hey, there we are. So does anybody have any questions? We got about 8 minutes, or you can go early, and those of you that are football fans or news fans or whatever you want to do at 5 o'clock. Sally's
Questions,
on
anyone?
mute. Can they unmute themselves? They can, right?
Yes, they can. Rose, is your husband still on this call? Maybe.
Well, she's muted, so,
Well, she should be able to.
oh, there she goes.
Rose,
Yes, yes,
is your husband still on the call?
he is. He's the other Rose here.
Okay,
I'm here.
what's his name though?
Randy,
Randy. Okay, just wanted to make sure. And then who's on the call with the phone number 2923? Hello?
not Rose.
No?
No. Our last four is 5052.
Larissa, do you know if that's somebody else from the city
There it is, the 292.
or from PD maybe?
I don't recognize the number, but I'm not sure.
This is Gretchen. I'm sorry, I was
Gretchen.
on mute.
Okay, got it.
I'm
All
on my
right.
phone and I'm on my computer
No, that's
without
okay.
sound or
No
camera.
problem. All right, we just wanted to make sure we had everybody's names so we could have, Karen's gonna send you all your certificates, so,
Oh, great.
all right. Well, if you don't have anything else, I just want to say, oh, Jan,
I
yes,
have-
you're always good
Hi,
for a question or comment.
Karen, can you please share the upcoming event that Oakwood is doing so that we're all aware of that?
Nope. I guess I can. November 7th from 4 to 7 at Riverview Park. And if anybody wants the flyer, I can email that out with your certificate, so I can do that. But we are doing, it's a fundraiser and it's socially distant. We actually a drive-in. So when you drive in, each car, you get a space, and your distance, you have to wear a mask. They're giving out masks from what I understand. And there's going to be entertainment, and I'm trying to think of, it's Mexican food catering. If maybe you know the company, because I can't remember it offhand. So there's going to be music and prizes and food.
And tailgating.
And tailgating, yes, there is a tailgate. There is a trunk contest, so you can decorate your trunk and whatever brings you joy. So if you're, some of the ones that I can, like I say, I think they sent me photos of some of the ones, whether it's Halloween. If I'm able to go, I may do a camping site because I got all this camping equipment I haven't been able to use this year. So I may just throw that all in my trunk and say, oh, I got my camp set up, because that does bring me joy. So we are having a contest on the trunk, but it's $100 a vehicle for 2 people. It's $150 if you want a chair and table. They will supply that as well. So it's our annual fundraiser. It's been a little difficult to keep our services going this year. We've been doing a lot of virtual classes and things, and our numbers are certainly way down because of the virus. We haven't been able to have people come to the facility. We can now. They do have it on a limited basis with the partitions and the masks and all the things in place that we need. But if anybody wants, you know what, I'll send Sal, or unless you have the flyer, Sally, that you can send out. I will send that to you right when we hang up, and then you can shoot it
I
out.
just sent you everybody's emails so you can
Oh,
send
good.
certificates.
All right.
So you have access to
I will
everything.
send that out as soon as I hang up here, but thank you for asking. Are you going, Jan?
I am. I'm actually bringing cake for you.
Oh.
So
Oh,
Gee,
wow.
that's a shock.
Cakes. Okay, sorry.
Jalapeno Bucks is doing the food. It's going to be really, really fun. So I encourage everybody to come out.
Jan, maybe they'll put our cars next to each other.
Let's do it.
We can only hope.
I was gonna say, are you gonna have, that's food back there. I only saw the candles. I didn't see all the cakes back there. So yeah,
They're there, but we'll bake fresh. So these aren't going to come.
we would appreciate that. Thank you.
All right, well, everyone, thank you very much for attending today. Please tell your friends and coworkers. I mean, it'd be great to have, others that go through the training with Karen, or maybe at some point you would consider doing some training too. But it would be nice for us to get more individuals and businesses involved. So that's it from me. Karen, anything else last minute?
No, I just went to the chat room and I appreciate Liz. Say hi to Jerry because I work with Jerry and on a variety of things. And Veronica, thank you for sharing about your dad. And so I appreciate the chats now that I can see them. So yeah, thank you very much, everybody. If you have any questions, just give me a holler and see what I can do.
All right, ladies and gentlemen.
Thank